Hello and welcome to Health Matters. My name is Dr. Michael Chillemi, and on today's episode, what we're going to talk about is the top 7 things we're going to do to help with reducing blood pressure. So on this episode, we're actually going to call it Heartwise. So today's episode will be Heartwise with Dr. Chillemi. And what we're going to really get into is the top 7 ways to lower blood pressure utilizing a mix of lifestyle changes, nutrition, more holistic type of changes is what we're gonna want to jump into. And we're gonna really push that to a deeper level than you probably thought of. I can give you some good information on why. So first thing we're going to talk about is in the top 7 is number 1 is adopt the DASH diet. What is the DASH diet? The DASH stands for the dietary approach to stop hypertension. It actually has stop hypertension in its name. So the diet is specifically designed to lower blood pressure and improve overall heart health. Here are some of the key facts about the DASH diet. So the DASH diet is meant to lower blood pressure. There has been extensive studies that show that the DASH diet followed has significantly lowered blood pressure. It has a high clinical success rate. Several clinical trials demonstrate the effectiveness of the DASH diet in reducing hypertension. These trials have shown not only to reduce hypertension in both systolic and diastolic pressure. The DASH diet promotes healthy heart by reducing the high blood pressure and cholesterol levels. This is done by also managing the food you eat, right? So the DASH diet is designed to prevent and manage high blood pressure by focusing on foods that are high in fruit. So the first thing we're going to want to look at is you're going to have a high fruit content and high vegetable, typically 4 to 5 servings per day. You're also going to have whole grains, should be based on your meals. That should be the basic form of your meals, right? The basic meals is whole grains. You're going to have lean proteins and low fat diet. So reducing red meat and going for more fish and chicken or plant-based options. Foods that are high in potassium, calcium, and magnesium. For those are very, very good in helping with reducing blood pressure. If you want a complete list about the DASH diet, then please go to the Mayo Clinic website. They have a complete comprehensive guidelines and suggestions of daily and weekly nutritional guidelines, as well as sample menus. Okay, number two on our list, the top 7. Maintaining a healthy weight is crucial for managing blood pressure and lowering blood pressure. Here's how it can impact your blood pressure. When you weigh less, it's going to reduce the strain on your heart, right? That makes sense, right? The less you weigh, the more your body is going to theoretically function better, right? Excessive weight increases the workload on your heart and can lead to higher blood pressure. So you want to reduce the workload and have a more effective heart. When you have a more effective heart, your ability to circulate blood is more efficient. You're going to improve when you reduce weight, you're going to improve your blood vessel function. Healthy weight supports better function of the blood vessels and decreases the risk of arteries stiffening, both of which can contribute to high blood pressure. Lowers the risk of hypertension. So when you manage your weight, you're going to reduce your risk of hypertension by reducing the abdominal fat around your stomach, right? So the more belly fat you have, I'm sure you all heard this, the more belly fat you have, the more at risk you are for hypertension. So The more we reduce, the more you lower your belly, the better you have a chance of reducing your risk of hypertension. Even a small amount of weight loss can lower your blood pressure. So if you combine your calorie intake with the exercises and set realistic goals to losing 1 to 2 pounds a week, usually is generally safe. That's what you're going to want to look to do. Okay, next, if we talk about exercises, so number 3 on the list will be lifestyle adjustments, exercising regularly. So when you exercise regularly, you're going to look to lower your resting blood pressure. So engaging in regular exercise activity helps reduce both systolic and diastolic blood pressure. Studies consistently show that aerobic exercises such as walking, running, cycling, swimming can reduce resting blood sugar by 5 to 7 points in those people with hypertension. Exercising regularly can improve your heart efficiency. With regular exercise, you strengthen your heart muscle, right? You remember your heart is a muscle. So a strong heart can pump more blood with less effort, reducing the force on the arteries and thus lowering your blood pressure. So when you exercise, you're also going to enhance your vascular health. Exercise is going to improve the elasticity of the health of the blood vessels, allowing them to dilate more easily and accommodate blood flow, which reduces your overall vascular resistance. We spoke about this in number 2, but weight management, obviously, through regular exercises, lowers your blood pressure. The more you weigh, the more you're going to put pressure on your heart. So even losing 10 pounds, if you're significantly overweight, can affect your blood pressure. When you exercise regularly, you're going to reduce your stress and anxiety levels. Physical activity has shown to stimulate the endorphins, which is your mood modifier, right? So if you release more endorphins, you're going to have a better mood and reduce your stress levels, which can contribute to lower blood pressure. Exercise can improve your insulin sensitivity. So regular exercises enhances the body's ability of effectively working with your insulin levels and helping your blood sugar levels. So since diabetes and hypertension go hand in hand, improving insulin sensitivity can definitely benefit your blood pressure management. Regular exercise can reduce inflammation. So if you have chronic inflammation throughout your body, when you do regular exercise, your body's going to definitely start functioning and moving better. As you lose weight, as you increase your blood flow, as you get your body moving, that's going to start pulling that inflammation out of your body. So the type of exercises that you could do are like aerobic exercises, such as walking, running, cycling, swimming, dancing. Typically, they suggest to do at least 150 minutes of moderate intensity a week, right? So 150 minutes equals 30 minutes, 5 days a week. 30 minutes, 5 days a week is 150 minutes. That's moderate. Now, if you do like a HIIT training or a high intensity, they say 75 minutes per week. So whether you do it 25 minutes for 3 times a week like that, or you break it up into 4 days at 20 minutes of high intensity, and if you wanted to do 4 days of moderate, you're going to look at somewhere around 35 minutes, 35 to 40 minutes is where you'd want to be 4 days a week at least. So I'm going to say you'd probably bump it up to the 40 minutes, 4 days a week if you're doing moderate. And then you could do 3 days at 25 minutes if you're doing high intensity per week. Another type of exercise that we're going to want to do is strength training. When you incorporate resistive weight training, it improves your overall strength and muscle and body composition. It is recommended to engage in regular strength exercises at least 2 days a week. So you're going to incorporate your aerobic with strength training to put together a full package of exercises. You're going to want to do some flexibility and balance exercises. That could be like yoga stretches, um, Pilates. All of those are going to help reduce your blood pressure. But being consistent is key, right? So if you have to actually go and do it and do it and do it, and you do it on the days you don't want to do it, you just got to keep pushing forward to get it done. Brisk walks are going to be something you're going to want to look at, right? You could do a brisk walk 30 minutes, 5 days a week to really improve your cardiac health. And the biggest thing is with that, start slow, right? You don't have to really reinvent the wheel and nobody expects anybody to go from 0 to 100, right? So if you're not exercising, you haven't exercised in years, maybe you start with 10 minutes the first day. Do that for 2 or 3 days. That's okay. Then you move it up to 15 minutes. That's okay for a couple of days. You move it up to 20 minutes, right? So you're going to keep moving it up by every couple of days. When you tolerate it, keep adding time to it. That's how you're going to slowly build and build and build. The more you increase, the better you're going to do, right? So that's typically what's going to happen. You're going to do better and better. And the different mixes of the workouts is what you're really going to want to look at to impact your ability to reduce your blood pressure. As always, consult a physician before you starting any program. You want to make sure your health provider or whoever's treating you for your high blood pressure is in agreement, and they might have a specific plan and care that they want to do instead of what you want to do. But it is important to incorporate regular physical activities into your lifestyle to improve your cardiac health. Okay. Next up on our list is number 4. Number 4 we're going to talk about is things to avoid. So the things to avoid, number 1 is reduce your salt intake. So excessive salt intake can increase or can lead to increasing your blood pressure over time. This happens because salt holds extra fluid in the body, right? So when you add more fluid to the body, you're going to create an additional burden on the heart and arteries. Over time, this can stiffen and narrow those blood vessels, decreasing the amount of oxygen and blood flow through the body and affecting your key organs. There is a little bit of controversy out there, so you might read something. So I'll let you know there is definitely controversies. There are some studies that say salt really doesn't have that much of an effect on you, and there are a significant amount of studies that show that it do. So nevertheless, it has been recommended and it stays recommended to reduce your salt intake to help control your blood pressure. Keep in mind that the average salt consumption is often well above the recommended amount, especially in America, right? In America, you go out anywhere, salt is a typical staple people use for cooking and seasoning. Reducing that sodium level, reducing that salt level is advised to help manage and prevent hypertension, leading to obviously heart disease and stroke. So you definitely want to manage that. Next thing we're going to talk about is what type of foods you want to avoid with salt. So anytime you're buying something that is pre-made, one of those meals that are in the freezer section of the supermarket and it's already pre-cooked, or you go to your local store and they made it already, the odds of them cooking with minimal amounts of salt is very low, right? So they usually have a ton of salt in there. That's what ends up keeping it out on the shelves longer, keeping it out in the refrigerator and freezer longer, right? So they're gonna definitely pack it with salt. So you want to avoid those type of foods and focus on the foods that have less salt. So cook at home yourself if you can and avoid it. Next thing we're going to talk about is alcohol. So according to the Mayo Clinic, alcohol consumption can have significant effects on blood pressure when consumed in light to moderation. Alcohol might affect or maybe even lower your blood pressure. However, drinking in large amounts can lead to increase in blood pressure, and consistently drinking 3 or more alcoholic drinks in a day will raise your blood pressure. Repetitive long-term drinking will have long-term effects and of high blood pressure and significant other damage. It's important to note that alcohol also has calories and may increase your weight by doing that. So reducing your intake is critical. And alcohol can affect some of your medication. So if you're on medication for high blood pressure and you're drinking, you can definitely affect the effects of your medication. So you really want to be smart about it and manage that well. Limiting your intake of alcohol is crucial for managing your blood pressure. In one of the Mayo Clinic studies I read, it was recommended that women should have no more than 1 drink per day and men no more than 2 drinks per day. So a typical drink is considered 12 ounces of, let's say, beer, or 5 ounces of wine, or 1.5 ounces of 80 proof liquor, right? So that's what they consider a typical drink. Chronic heavy drinking can cause hypertension and increase the risk of heart disease and stroke. Therefore, keeping it to light to moderate. More light is better, right? So less is better. With keeping your levels of alcohol level, because you don't want to have another problem, right? So you don't want to try to fix your heart and then have another problem with something else, whether you're gaining weight or now you just cause yourself to have even a bigger problem because of excessive alcohol drinking. So you want to minimize that. You want to maintain your overall cardiovascular health. Okay. Next up on our list is smoking. So this is number 4 on our list. Might have skipped a 5. Okay, so we're going to quit smoking. So smoking is a significant risk factor for hypertension and heart disease. Smoking has notable effects on blood pressure, which can significantly impact cardiovascular health. Here are some key points on that. So when you smoke, you're going to temporarily increase the blood pressure. The nicotine in cigarettes stimulates the adrenal glands to release adrenaline. This hormone causes an increase in heart rate, right? So your adrenaline's going to spike, your blood pressure is going to spike. Long-term hypertension risks are associated with chronic smoking, right? So long-term smoking can lead to high blood pressure. The substances in cigarettes contribute to the buildup of plaque inside arteries as well, known as arteriosclerosis, which causes those blood vessels to go from big to small because they're going to narrow them, right? So it makes it harder for your blood flow to flow through. The increase in blood pressure and ultimately gives you a significant risk of hypertension. So obviously, if you do anything long enough, you're going to have lasting effects. So when you are a chronic smoker, and I know people in the 50s, 60s, and 70s, and 80s, that was kind of the thing back then until they started realizing all these problems that they had. And over the last 20 years, what they've noticed is chronic long-term smoking directly affects your heart in significant ways. And it doesn't hit you till later on, right? So a lot of times we do things and we don't realize the effects of it until we get later on. So things build, little changes happen in our body. We don't even really recognize it because we don't see it. But as you do things, your body will recognize it and your body will start to change. So if somebody like this with chronic smoking causing arterial sclerosis will affect your blood pressure, will affect your ability and your function on your heart. So it was interesting as I was doing some research for this. It said the effects of heart rate and blood pressure. Studies have shown that both smoking and nicotine replacement therapies can affect heart rate and blood pressure. Even when smokers switch to the patch, there still can be elevated levels of your epinephrine or adrenalines, which affect your blood pressure. Secondhand smoke also poses risks leading to increase in blood pressure, therefore affecting non-smokers sharing the same environment with smokers. So the immediate effects of smoking is a spike in blood pressure due to the nicotine. Long-term smokers face the risk of chronic hypertension and related cardiovascular disease, which have cumulative effects in the cardiac system. Okay. Next up on our list is going to be managing stress. So stress management is crucial for healthy blood pressure. Chronic stress can lead to sustained high blood pressure, which can then turn into an increase in a risk of heart disease or stroke. We're going to go over several effective strategies to manage stress and its impact on blood pressure. So we're going to want to talk about stress relieving techniques like meditation, yoga, deep breathing exercises. You're going to want to engage in hobbies that you enjoy, or if you don't have one, try to start something new. Right? You got to do things that you enjoy that bring that level down. For me personally, it's exercise. That brings me to my next part of this one. Exercise we talked about that in the beginning of exercise, right? Where I talked about exercise actually lowering your stress levels because of the things that it's releasing, right? So that's important. You got to exercise. Mindful and relaxation techniques, talking about the meditation, practicing mindful or meditation can help calm the mind and therefore reduce stress. Focused on that focused breathing can reduce your blood pressure. Yoga is going to combine your physical postures, breathing exercises with meditation to reduce your overall heart health. Adequate sleep is going to reduce your blood pressure by having. So when I say that, it's because when you have a good quality 7 to 9 hours sleep, your body's going to reset itself. When you reset your body, you're going to have a better chance at having all your natural chemicals work the way they're supposed to, right? You're not going to shut off all those different body activities. When we don't have enough sleep, little secret is your body doesn't replenish the things it needs. That's the purpose of sleep. You think it's just to relax your mind, but it's actually your body needs it to regenerate different tissues and cells and organs, right? You're sleeping, your body's working harder for other things. Excuse me, things that you don't think about. Sodium levels, potassium levels, all these different levels that we have throughout our body. Your body is managing them. That's what it's doing while you're sleeping. So it's actually working. Pretty amazing. Other things that you can do to reduce your stress is connection, social interaction, spend time with friends and family, support groups, sharing feelings with others in support groups is important for you to get that out. And that's why therapy exists, so you can reduce your stress. Sometimes things get overwhelming for people, and if you can get it out, you don't have to build up, right? You don't want to build it up. You want to get it out. So having a therapist to consult with can definitely do that. So managing stress was number 6. The last of the 7, my favorite, because it's vitamins and herbs, right? Essential supplements and vitamins have been studied for their potential benefits in managing blood pressure. So while these can complement a healthy diet and lifestyle, they're obviously not going to replace a prescription or any other recommendations by your healthcare provider. But let's go over a few essential vitamins and supplements that can help regulate your blood pressure. So the first one that we'll talk about is potassium. Potassium helps the balance of sodium in your body, which can help reduce your blood pressure. So some of the good sources of potassium are bananas, potatoes, spinach, artichokes. Potassium supplements are available, but should be used under strict medical advice. You don't want to get a problem with potassium, right? You can get hyperchemia, which is high levels of potassium. And that can have another problem. So moderation. Magnesium is the next one that we'll talk about. Magnesium plays a role in your body's blood pressure regulatory system by influencing the relaxation of blood vessels. Foods you're going to eat with that are nuts, seeds, whole grains, leafy greens. Supplements are also available, and they're considered generally safe. Next up on our list is calcium. Adequate calcium levels supports overall cardiovascular health, including blood pressure regulations. Sources include dairy products, fortified plant foods, milk, green leafy vegetables. Calciums are available in dietary supplements as well. Omega-3 fatty acids, which are typically found in fish oils, have been shown to promote cardiovascular health and lower blood pressure. Again, fishes like salmon, mackerel, sardines, and actually flax seeds and chia seeds have omega-3 fatty acids. Fish oils, and you could also get them in tablet form for supplements. Next, coenzyme Q10 acts as an antioxidant and supports heart health, with some studies showing it helps reduce blood pressure with its supplementations. The sources of it are going to be meats like fish, whole grains, chicken. There are supplements available for that as well. Vitamin D will be next up on the list. Vitamin D has been linked to helping with hypertension. So when you have a deficiency in vitamin D, that's been shown to have people that have higher levels of blood pressure. So the more vitamin D you have, the better. So sources, sunlight, right? Go outside. Fortified foods, fatty fish, egg yolks, definitely supplements are available. Garlic extract. Garlics that have compounds. Garlic has compounds in it that can contribute to lowering your blood pressure. Sources, fresh garlic, right? You can get garlic tablets as well, and that can help reduce your blood pressure. L-arginine. L-arginine is a amino acid that may help lower blood pressure by relaxing your blood vessels. Sources: red meat, which you need to limit, poultry, fish, and dairy products. Supplements are available for that as well. While vitamins and supplements can help manage your blood pressure, they should be part of a broader strategy that includes diet, exercise, and lifestyle management. Always, always consult with a healthcare professional before starting any new supplement or any new program to ensure your appropriate health for you. So I'm going to kind of wrap this up for everybody. So regular health monitoring is important. You need to keep an eye on your numbers. You need to have a home blood pressure monitoring and track it. Regular visits to your healthcare provider can help ensure your treatment and therapy is going the way it should be. The way it should be. So that was your top 7 ways to lower your blood pressure through a combination of lifestyle changes, exercise, key nutrients, stress management. All those things that we just discussed are things to help lower your blood pressure. Lowering your blood pressure is not about adding years to your life, but adding life to your years. I'm going to say that again because I think it's a really cool line. So lowering your blood pressure is not about adding years to your life. It's about adding life to your years. Meaning, you want to be able to do things. You want to be able to function. You want to be able to live. You want to be able to go where you want to go, do what you want to do. Having a handle on your health starts with your heart. As always, my opinions here are just my opinions. Anything I talked about here is specifically my opinion alone. It should not be construed as any kind of medical advice. It is just my opinion. I suggest you consult with your physician, do your own research. But most of all, go through the tips, see how you can apply any of them into your life, if that's what you need. Monitor your blood pressure, right? The heart is one of the biggest killers in America today. Be smart with that. So thank you again for joining us on another edition of Heartwise with Dr. Chillemi. We're going to say follow us on TikTok, Facebook, Instagram, all the goodies out there. We're pretty much everywhere on social media. If you know anybody that this can help, please send this to them. One of these tips might be one of those things that you give your friend or loved one life to their years, not just years to their life, right? Life back to their years. So you never know, one little suggestion can help somebody. So until next time, I'm going to say, stay healthy. It's your life. Be there healthy because health matters. Be well.